Paul Hunter, who's an epidemiologist, also professor in medicine at the University of East Anglia here in the UK. Thanks so much indeed for your time. How concerned are you that the EMA has not been able to definitively dismiss any possible link between the AstraZeneca vaccine and the formation of blood clots?
I mean, this is part of the problem with public health. Trying to prove negatives is extremely difficult. I think, having said that, I think in general, the reports of blood clots that we're seeing, including within the UK's yellow card scheme, that are basically less than you'd expect in the normal population anyway. So I think overall, the evidence is that there is no increased risk of blood clots. There has been reports of an association with a couple of relatively rare conditions. One, cerebral venous sinus thrombosis, which is pretty rare, but is probably actually more common than people have realized until relatively recently. And the problem is with these sort of rare conditions is that often you see clustering by chance, and trying to then prove that that clustering by chance is due to a drug or a vaccine or not is actually quite difficult. But the bottom line is that and I think most of us believe that it's not caused by the vaccine, but even if it was, the risk is so low compared to the risk of COVID if you don't have the vaccine. And in fact, one point that was made very clearly in the interview was that actually, because COVID itself causes these clots, not having the vaccine is more likely to increase your risk of getting thrombosis because you then get COVID.
Yeah, Paul, you're even throwing ahead to my next question. You've kind of answered it about the dangers of what the vaccine might do to the human body compared to what the virus does. But then you also mentioned the numbers, and we're talking about a 1% mortality rate amongst people who have COVID-19 compared to a tiny, much smaller percentage of people who have developed blood clots from having the Oxford-AstraZeneca vaccine.
Absolutely. I think the infection mortality rate from COVID is a bit lower than 1% now because of improved treatments and indeed the early effects of vaccination, which even if you do get an infection after vaccination, you're much less likely to die than you would if you'd got an infection without having had prior vaccine. So yes, the importance is to have the vaccine because that's guaranteed to reduce your risk of getting severe disease and dying.
As an epidemiologist, do you think the world is placing too much hope in vaccines? What are the other risks that might make the coronavirus actually live longer than people are expecting it to now that vaccines are beginning to roll out?
Well, I think the first thing to say is no epidemiologist that I'm aware of believes that the virus is actually going away anytime soon. And I've been saying for getting on for over 6 months now that actually our grandchildren's grandchildren will probably be getting infected with COVID, but they won't be getting the severe disease that we're seeing now for a variety of reasons. And the whole point of vaccination at the moment is keeping people from dying, keeping people from being sick, so ill that they need to be in intensive care units, till the point that this virus just becomes one of the other causes of the common cold, like many of its sister viruses, other coronaviruses have done in human history. That won't be any time in the next months, but it's something that in a few years we will still be seeing COVID, but it'll be much less of a health problem than we're seeing now.
Paul, really appreciate it. Thank you so much indeed for talking to us. That's Paul Hunter from the University of East Anglia.